Guys, welcome back to Medical Coding with Blue. Today's episode is going to be my goodbye to my CCA or the Certified Coding Associate credential. And I'm also going to be discussing the virtues of this very wonderful credential. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay, so on Tuesday, March the 30th, 2021, I sat for the very first time for the CCS-P or the Certified Coding Specialist Physician Base exam from AHIMA, and I passed. So that day, my CCA or my Certified Coding Associate credential was superseded by this CCS-P. Now, what this means is I am no longer able to carry the CCA anymore because with AHIMA, they have that if you pass the CCS-P or the CCS, the Certified Coding Specialist, right? That if you have the CCA just goes away because they're saying that this CCS-P or the CCS outranks the beginner credential and you no longer need that designation. That is something that I really wish would change because I think it shows career progression. But that's just me, and again, I'm a small voice. I did serve on the CCA exam task force for review, and I did voice this concern when I was there many moons ago because I got my CCA in 2008. And when I voiced my concern, they just sort of said, oh, okay, well, this is the rules, and this is what we do with our association. Okay, so here I am. But there's a lot of industry bad talk about the CCA, and which is upsetting because if you truly know what goes into studying for the CCA and the rigorousness of this exam, I think that people would not say such horrible things or not be so dismissive of somebody who has the CCA. The marketing on the CCA really should be a lot better, right? But I'm going to give you guys some of this information and some of these facts so that you can really understand when somebody tells you that they have a CCA, this is what they're bringing and this is what they're coming with, all this knowledge. But I want to talk about this first. As of December 31st, 2019, there were 7,945 certified CCA professionals. In 2019, there were 1,756 first-time test takers. The first-time pass rate was 82%. So 82% of these folks were able to pass this test the first time. In 2018, that first-time pass rate was 77%. And in 2017, the first-time pass rate was 68%. I want you guys to know that this is a very tough exam. This is not an exam that you can just sort of whiz through and, oh, it's so easy. See, the American Health Information Management Association has some of the toughest exams in the industry because they have been around for a very long time. And some of the things that you have to know to pass the CCA exam. Now, this is the outline that is available on the AHIMA website. And the first domain is the clinical classification systems. This makes up 30 to 34% of the exam. So the tasks: interpret healthcare data for a code assignment, incorporate clinical vocabularies and terminologies used in health information systems, abstract pertinent information from medical records, consult reference materials to facilitate code assignment, apply inpatient coding guidelines, apply outpatient coding guidelines, apply physician coding guidelines, assign inpatient codes, assign outpatient codes, assign physician codes, and sequence codes in a healthcare setting. And the second domain is reimbursement methodologies. This makes up 21 to 25% of the exam. You have to sequence codes for optimal reimbursement. You have to link diagnoses and CPT codes according to payer-specific guidelines. You have to assign correct DRG. You have to assign correct APC. You have to evaluate NCCI edits. You have to reconcile NCCI edits. You have to validate medical necessity using LCD and NCD. You have to submit claim forms, communicate with financial departments, evaluate claim denials, respond to claim denials, resubmit denied claim to the payer source, and communicate with physicians to clarify documentation, so like queries. And then the third domain is health record and data content, 13 to 17% of the exam. Retrieve medical records, assemble medical records according to healthcare setting, analyze medical records qualitative for completeness, analyze medical records for quantitative, quantitative for completeness, qualitative for deficiencies, sorry about that, and then perform data abstraction, request patient-specific documentation from other sources, ancillary departments, physician office, etc., retrieve patient information from master patient index, educate providers in regards to health data standards, and generate reports for data analysis. And then domain 4 is compliance, which makes up 12 to 16% of this exam. Identify discrepancies between coded data and supporting documentation. Validate that codes assigned by the provider or electronic systems are supported by proper documentation. So basically auditing. Perform ethical coding. Clarify documentation through physician query. Research latest coding changes. Implement latest coding changes. Update fee/charge ticket based on latest coding changes. Educate providers on compliant coding. Assist in preparing the organization for external audits. And domain 5, which is information technologies, which makes up 6 to 10% of this exam. The task is navigate through an EHR or electronic health record, utilize encoding and grouping software, utilize practice management and AHIMA systems, utilize CAC software that automatically assigns codes based on electronic text, or validate the codes assigned by CAC software. And then domain 6 is confidentiality and privacy, which makes up 6 to 10% of this exam. Ensure patient confidentiality, educate healthcare staff on privacy and confidentiality issues, recognize and report privacy issues/violations, maintain a secure work environment, utilize passcodes, access only minimal necessary documents/information, release patient-specific data to authorize individuals, protect electronic documents through encryption, transfer electronic documents through secure sites, retain confidential records appropriately, destroy confidential records appropriately. So somebody who has the CCA credential has to know all of these things, or a combination of these things, in order to pass this certification exam. This certification exam is only 2 hours. It is one of these most shortest times for exams, but it packs a lot of questions, and complex questions at that, in such a short time. So the fact that it gets dismissed a lot as, oh, nobody asked for that, or this credential's better, or that credential's better, is really garbage, honestly, you guys, because you have to know a lot. And there were 34 people in my class, and I was the only person to pass the CCA the first time when I took it. And when you think about it, in 2017, it was what, 68%? The pass rate was 68%. I believe the first time pass rate when I took it in 2008 was a lot lower. So I want you guys to know that when you are looking and judging somebody based on the credential that they have, that this is a very immature action. I don't judge anybody based on the credentials that they have, as long as they're certified with AHIMA or AAPC, because these are the two major medical coding associations, right? And that's all. When I'm looking at somebody, I'm like, okay, great, because I know what they've done to take these exams. But I never say, well, this association's better, or that association's better, or whatever, what have you. I never do that. I look at the caliber of the coder. That's what matters, not what credentials they hold. Because I've seen people who have really high credentials, or at least one high credential, who struggle with coding. And even though they have many years of experience, they've sort of stayed in one position for a very long time and never grew or branched out. But just because they have a high credential, they're looked at like, oh, okay, well, this person must know a lot. If you're not growing, if you're not continuing to grow, that knowledge sort of fades away. And as time goes on, right, it gets to be a lot less over time. That's why you always have to continue to study. And when I took this exam, I studied. I mean, I studied so hard. And the reason that I did was because I wanted to change my life. I wanted something that was going to be able to support me. I knew that this was something that I was going to enjoy because I enjoyed the process of learning it. But it was the test part that was just like, oh. So finally, when I did get my credential, my CCA, I was so happy, obviously. And being the only person that had passed in my class, you know, that was, I mean, it was sad because it's like, what happened to everybody else? But, you know, I mean, I was just glad that I could take my credential and start looking for a job and start going from there. I got my first job by going through a temporary agency because I was running into the same problem that a lot of people get when they very first get their credential. And it's not just limited to just CCAs that have this problem. CPCs have this problem. CCSs have this problem. So there's everybody that goes through this. Even degree holders have this problem. So I was not in a minority, obviously. I was in the majority with everybody else that was going through this issue. But when I got my first job, and then subsequently 3 months later when I got my second job with the help of the temporary agency, being in that second job, I learned a lot, and I went in with the attitude of, I'm gonna take whatever they give me. I am going to study hard. I'm gonna make sure that I just keep going. And at the time in that hospital, I was the only person holding a CCA. So a lot of people, everybody else was like they either had their CCS-P, they had a CCS, or they had the CPC. So I was the only one with the CCA. So to be able to get in, it was just like, okay, you know, I'm here with these people and we're making the same amount of money. So it's not like there was one credential that got paid more and everybody was level. So spending my time there and learning everything that I could learn about profi coding and all of this, you know, really in-depth stuff, and really developing my skills as a medical coder and learning how to handle my workload and handle the high volume of encounters that I was getting, and coming up with ways of knocking out lots of encounters, which that's something I haven't really talked about on my channel yet, in which I will now that I think about it. But I did come up with ways to knock out a bunch all at one time, and it worked. It worked, and the accuracy was there. And so again, doing the profi coding, I was having to learn ways of speeding up the process wherever I could because of the high volume of encounters that were there. So coming here to where I am currently, I still have my CCA at this time, right? I've had my CCA at that time since 2008, you know, and I got hired here as well. And every single time I've gotten hired, the money went up. And I don't talk about money in specifics on my channel, so don't get excited. But it went up substantially every single time. My CCA did not stop my ability to be able to earn money. That's number one. And number two, I've known degree holders who did not make as much as I did. So, and I only have a CCA. So again, for people that they would say, oh, well, what do you have? You know, and I would say, oh, I have a CCA. Really? And so that dismissive attitude also fueled my ability to be able to learn more. Because I'm already a studier as it is, but then, you know, you want to kind of make not nice comments about my credential. Okay, well, this is what somebody with my credential can do. So I've been an educator for providers. I've been an educator for brand new medical coders. I've been an educator for auditors. I've been an educator for degree holders. So there's nothing that has stopped me from developing. And I had gotten another position as well with my CCA. again, being the only person with the CCA and working with same-day surgeries and that kind of thing. So those types of positions, they're open for somebody who has a CCA, because the CCA gets tested on both inpatient and outpatient coding. So we're well-rounded. It's just the beginning, and they want to make sure that we know. So my career has been pretty incredible that I've had this one credential and been able to do all of this and be as successful as I have been. So if you have your CCA out there, that's great. Don't ever let anybody tell you that, oh, that credential's no good, no one asked for that, because people get jobs with those all the time. It just takes somebody that will be like, okay, are you certified with AAPC or AHIMA? Great. Well, here you go. How are you presenting yourself? Because that's what I had to do. We all go through this. But I just wish that people in the industry would stop with this, oh, that credential's better, that credential's better, this association's better, that. No. It's about the coder themselves. Because like I said, I've seen people who have degrees. I've seen people who have an alphabet after their name. I've seen people with higher credentials that struggle with coding. Now, if you're struggling with coding and you have all that education, what are you doing? So, and can we reserve the judgment? Can we reserve the judgment from there? Because again, it's about learning. And I'm willing to learn from anybody. I'm willing to learn from degree holders, from people who have a CPCs, from people who have a CCS or a CCS-P. I'm willing to learn from everybody. Because that's what I do. I learn, and I choose not to get involved in that riffraff of, oh, this one's better, that one's better. It's the caliber of the coder. You should always strive to be a high caliber medical coder. And I will always recommend a CCA. And one day, when I get to that position where I'm going to have to do the hiring, oh yeah, you betcha, CCAs, welcome. CPCAs are welcome. CCS are welcome. CCS-P are welcome. RHIA, RHIT. Everybody is welcome. It's going to be based on their knowledge, based on can they learn? Because that's what it should be about. It shouldn't be about, oh, you're better, you're better, you're better. These credentials are designed to say where you are trained to code. That is what they're designed to say. So I'm just going to throw that out there. And I felt sad when I had to change. I had to change my signature block the very next day when I went back to work. I changed my signature block. The plate on my door had to be changed on my office. I have my own office. And so the plate on my door had to be changed. And, there's a lot of things that had to change. Simply just because of my name now, right? And updating and making sure that my professional designation, the CCS-P, is there. I'm very happy to have the CCS-P. And a lot of people have asked me over the years, why don't you have a higher credential? Why don't you, go for another credential? Because at the time, it wasn't important to me. I had already made so many strides with just having my CCA. And to me, it was just like, why should I? And now that I have this public face, right, being a YouTuber and being a medical coder on YouTube, there's a lot of things that are changing for me personally. And because of this, it was just time. It was time for me to make that step and to take that next path in my journey. But if I had my way, I would definitely make sure that everybody knows that the CCA is such a wonderful credential, and that people that have it have had to study really hard to get it. And their knowledge base is really great because of all of the things that they have to know. And so that's something that I'm always going to advocate for. I'm always going to advocate for that CCA. And for people that have it, you develop on your own time. Don't ever let anybody push you or say you should get this, you should get that. When you're ready and when you want to advance, if you're going to advance on the outpatient side, shoot for that CCS-P if you want to stick with the AHIMA credentials. If you're wanting to go with both inpatient and outpatient, even though you've already been tested inpatient and outpatient, the advancedness of the CCS, when you've had experience to really understand what's happening, what's going on, is really a wonderful credential to get as well. But the CCA is a great place to start. It is a great credential to have. There are doctors who hold a CCA. Bet you didn't know that, did you? When you read articles written by doctors a lot, you'll see what kind of designations they have, especially the ones that are into medical coding. Now, there's nothing better to me than a doctor who loves medical coding because they get it and they want to understand. I really miss the physician champion that used to be coming around to our facility. He doesn't work with our facility groups anymore, but he was awesome. He was amazing. But he had his CPC. He had his CPC, and he was so good at what he did. He had passion for what he did, and I loved to hear him talk. He would come by every 6 months, and just hearing him talk and hearing him go on and things like that, and the fact that he knew and understood detail when it came to coding was the most awesome part. But again, I was willing to listen to him and take his information in because I didn't have the blinder on of, oh, I'm not going to listen to him because he's with another association. I never did that. And I learned from him. So I want you guys to know that when you're out there and you may hear this in your office, oh, well, this one's better, that one's better. Look and consider the source. Where is it coming from? You know, and your journey is your journey. No one was going to push me but me, right? But nothing was going to change until I was ready. And for me, now that I have YouTube really changed everything for me. It's still changing things for me. And I'm excited about this. I'm excited for the future. I'm excited for what I'm going to have with the CCS-P. And I'm going to miss being a CCA. But, you know, it's just part of the process and part of the journey. So, but I'm going to go ahead and wrap this one up. But I hope that you guys will consider the CCA more seriously. And I hope that when you're out there, that you're not part of that rhetoric either about the CCA. We all need to build each other up, especially in the medical coding community, because there's a lot of negative out there about either jobs or credentials or associations. Start looking at the individuals themselves. Start looking at what they're bringing to the industry instead of what their credentials are. I'm just saying. I'll see y'all tomorrow for tomorrow's episode. Please give this a like. Please share it if it helped you. And I will see y'all again. Bye.